Sounds coming up to you from One Republic, and that was No Vacancy right here on TRAXXfm. If you happen to join us on the show, while it is the second hour of the show, and yes, definitely it is interview of the day, different days, different themes on Momentum. Stay tuned. Back in a bit. Welcome back to the show. Hi there, this is Gilbert here together with my producer. We have Achu and also Azura in the studios, and definitely a very special guest who will be talking on today's topic, Health on Traxx, the control of smoking products for Public Health Act 2024. That's Act 852. And today we'll be talking to Dr. Muhamad Hairul Nizam Abdul Hamid, who's the Senior Principal Assistant Director, Disease Control Division, Ministry of Health, Malaysia. And just to let you know, our listeners, if you happen to be on our social media platforms, it's TRAXXfm and TRAXXfm Official on TikTok, on Facebook page, and definitely on YouTube. So if you happen to have any questions or probably would like to say hello to Dr., well, you could do so on our social media platform. It's Gilbert here on Momentum Health on Traxx, and just to let you know, the long anticipated control of smoking products for Public Health Act 2024, and that's the Act 852, gazetted earlier this year on 2nd of February, and now came into force, which is on the 1st of October this year. Now, just to let you know that the Act regulates, among others, the registration, sale, packaging, and labeling of tobacco products, smoking substances, and substitute tobacco products. Now, it's also prohibited for the sale of any regulated product and provision of smoking-related services to minors. And today, talking to our guests in the studio, it's so nice to have him here with a Senior Principal Assistant Director, Disease Control Division, Ministry of Health, Malaysia. And today we'll be talking to Dr. Muhamad Hairul Nizam Abdul Hamid. A very good morning to you, Doctor. How are you?
Hello, good morning, Gilbert. Thank you.
How was the holidays, the weekend?
I don't have holiday. Working over the weekend, of course.
There you go. You have somebody who just works through all the holidays and, of course, to keep us healthy.
Yes.
Okay, Doctor, getting into our topic for today, could you just please explain what is the control of smoking products for Public Health Act 2024, as mentioned, the Act 852. Could you just elaborate on that? But before that, Doctor, we'd like to know a little bit about yourself. How about introducing yourself to our listeners?
Okay, thank you, Gilbert. Okay, and also listeners, I am Dr. Muhammad Hairul Nizam bin Abdul Hamid, currently working in the Disease Control Division, Ministry of Health, Malaysia.
Okay.
I was in the service for like 17 years. I was previously the pediatric medical officer in my previous hospital, 2 hospitals previously. So I am also in charge currently under the Disease Control Division, particularly doing the policy on the tobacco control and also vaping issues as well. Okay. So we are in the department who regulate or make the regulation and this act, and was bring this act to the parliament and successfully enforced this year. So Alhamdulillah, we hope that this act can be supported by all.
Mm-hmm. Okay. Right. So Doctor, yes, coming back to the question that I just asked you, could you just explain a little bit about the control of smoking products for Public Health Act 2024, Act 852?
Okay, thank you. For this, the control of smoking product for Public Health Act, also known as Act 852, is a standalone act which control on the related to registration, advertisement, control of sale and purchase of tobacco product, smoking substance, and substitute tobacco product. It is a standalone act. We have developed this act since 2004. While we are in the process of when we registered or when we become the parties for the WHO FCTC, which is the World Health Organization Framework Convention on the Tobacco Control. During that time, we know that the process of developing a new act for the country is not easy. It has to be tabled to the parliament. It has to get royal consent first. So that's why in 2004, it was 20 years ago, so we developed a regulation known as Control of Tobacco Product Regulations, or CTPR 2004, while it was part in the Food Act 1983 or Act 281. So this regulation mainly talk about or regulate on the tobacco product. However, we've seen that the the prevalence of smoking, especially vaping issues,
Right.
are increasing trend. So that's why after the 2008, we tried to draft a new act along the way, and we successfully managed to bring this act or this new bill to the parliament 3 times. After 3 times only, we and 2 parliamentary select committee, we successfully gazette this act on 2nd of February 2023,
Right.
2024, 2nd February this year, and successfully this act come into force on 1st of October 2024,
Right.
and it has 13 subsidiaries under this Act 852,
Right.
in short. So administratively, we try to enforce all the act simultaneously, but we know that it's difficult. So that's why we bring this act into periods like 4 to 12 months educational enforcement before it will fully enforce by 1st of October 2025 next year, hopefully.
Okay, so there you go. It's not an easy thing to do this, the process of getting an act to be tabled or as a bill in Parliament. And it's, as explained by Doctor himself, it's not a very easy thing. And tirelessly, they have worked and successfully made it come into force.
Yeah.
Doctor, what are the differences between the previous act and the current law that we have right now?
Right. So as I mentioned just now, the Control of Tobacco Product, CTPR also known, 2004, under the Food Act, was mainly to control the tobacco products such as the cigar, cigarette, tobacco molasses, and also anything related to tobacco, and also snus, the one we used to ingest. Yeah, but at the same time, we know that certain products like vape, we don't have any power to regulate. It is previously put under the Poison Act 1952.
Okay.
But under this Control of Tobacco Product for Public Health Act 2024, as the name itself, smoking product, control of smoking product. So the scope has been broadened up to cover the tobacco products,
Right.
smoking substance, and substitute tobacco product. So the smoking substance I mentioned is the vape and e-cigarette. So
Right.
that's why the scope will be broadened, and all smoking products are treated equally, where they need to fulfill all the regulations and orders under this act. And on top of that, the non-smoking areas also have been widened. We also increased from 23 to 28 under the current regulations
Right.
under this Act 852.
Okay, so there you go. Explained very briefly about Act 852 and the Control of Smoking Products for Public Health Act 2024, which is Act 852, and it came into force on the 1st of October just this year.
Yep.
With all the efforts put in by the people behind the Ministry of Health in Malaysia. Thank you so much. We're going to take a short break here, a song break, and when we come back, we'll be talking more to Dr. Muhamad, Hairul, Nizam, Abdul Hamid, who is the Senior Principal Assistant Director, Disease Control Division of Ministry of Health, Malaysia. And yes, very interesting topic today, Control of Smoking Products for Public Health Act 2024, Act 852. Stay tuned, don't go anywhere. Welcome back to the show. Hi there. Very good morning. This is Gilbert here together with my producer, Achu. And yes, we happen to be live on our social media platforms, on TikTok and also on Facebook. It's TRAXXfm. And on YouTube, it is TRAXXfm Official. Saying hello and a very good morning to all of you. And yes, for some of us who are back again for work or probably back again school, well, thank you so much for tuning in to TRAXXfm. And as you know, on Momentum, different days with different themes. On Monday, it is Health on Traxx, and we have our guests in the studios talking about the Control of Smoking Products for Public Health Act 2024, which is Act 852 that went in force on the 1st of October 2024 after it was tabled in Parliament. And today, talking to our guests in the studio, Dr. Muhamad, Hairul, Nizam, Abdul Hamid, who's the Senior Principal Assistant Director, Disease Control Division, Ministry of Health, Malaysia. Good morning, welcome back, Doctor. And thank you. And Doctor, you were talking about earlier on. We were talking about how the Act came in play, how the Ministry of Health played an important role in tabling the Act in Parliament, and it took it did take some time for it to be approved and to be enforced. Doctor, moving on to our next question here. Now, could you tell us the scopes regulated under Act 852?
Right. There are two components regulated under this Act, which mainly the control of product itself, namely the tobacco products, as I mentioned just now, the cigar, cigarette, shisha, molasses, snus, and so on. We also have the smoking substance, which I meant the e-cigarette and also vape, and also substitute tobacco product where it makes not from the tobacco itself, but it's from other alternative like from the herbs leaf and so on. So we covered under this Act, and at the same time we also control the purchasing, the selling, and also the using of any smoking product by minors. I mean those who are below 18 years old. So all products. And under this Act, all products are treated equally. They need to be registered first to the Ministry of Health Malaysia to get approved. Then only they can be imported or manufactured in Malaysia. And also they need to notify the product content to the MOH so that we know if anything happen, any acute or critical event happen, so we can withdraw that product from the market. And this is also in line with Article 9 and 10 of the WHO FCTC, whereby the manufacturer or importer need to notify the product content to the MOH so that we know what are the ingredients are. Apart from that, we also prohibit the industry from excessively advertise the product, promote and also sponsor, as we know that there are many advertisement, especially on the social media,
Right.
especially the vape and so on. So we prohibit them from any online promotion and so on. At the same time, for the control of sale, we also prohibit the products, any smoking product, to be openly displayed at the counter or in the specialized store. They need to put a certain regulation whereby the product cannot be seen from outside the store itself. So there are certain regulations that need to be complied by the industry and also the manufacturer and also as importer. And we hope that this can be complied by the industry itself.
Understand. So there you go. Explained well by Doctor himself, the scopes regulated under the Act 852, which is a standalone act, as Doctor did mention just now. Doctor, here, how does this particular act could curb smoking issues, especially vaping among the youngsters?
Yes.
That's like a trend to everybody, all right? So how does this work?
We see that the numbers or prevalence of vaping, especially among youngsters, is very worrying. We know that from our previous Dawson House survey, with like from 9.8% to 14.9% in 2022, just 5 years.
Okay.
So we want to curb these smoking or vaping issues very thoroughly. So what we did, so we hope that the implementation of this act by putting it the packaging, prohibition of advertisement, promotion and sponsorship, they need to be registered and so on, will help to control, to reduce the affordability and accessibility by the minors. Apart from that, we also have prohibit the design, the fancy design by the e-cigarette and also vape, because as we can see that in the from the market, they pack in a fancy design in the toys and so on.
Right.
So under this act, we prohibit them, especially products that resemble food and also toys from being sold to the minors, because this is like promotion to the minors.
Okay.
Along the way, the MOH also has prepared the 5-year advocacy plan to quit smoking,
Right.
Especially for children starting from home to the kindergarten, to the school, to the higher education institution, even if they enter the community. So we have a plan, the 5-year advocacy plan for them to quit smoking. And also for those who already started smoking, we help them through kotak program. Kotak is we call the Kesihatan Oral Tanpa Amalan Merokok, run by the dentist officer.
Okay.
A dental officer, they went to the all public schools in Malaysia, 99% schools in Malaysia. So they run, apart from the screening, they give also brief intervention to the smokers. We know that the numbers of smokers at school are worrying. I think there are about 1,000 to 2,000 smokers in primary school, and
Okay.
also 60 to 70,000 smokers in secondary school. So this is numbers that we should worry actually.
Right.
So this kotak program helps them to quit smoking and also vaping. So I hope that by the implementation of this act, this will come, the numbers will reduce, and also the youngster can help to quit smoking.
Okay, so putting it to be aware with the younger generation, and that's what Doctor was explaining to us. Back in a bit, stay tuned. This is Health on Traxx Momentum. Health on Traxx, yes, on Momentum, different days, different themes in the second hour of the show, and today it is Health on Traxx, the Control of Smoking Products for Public Health Act 2024, Act 852, and talking to Dr. Muhamad, Hairul Nizam Abdul Hamid, who's the Senior Principal Assistant Director, Disease Control Division, Ministry of Health, Malaysia, and as the good doctor was talking to us about how the regulations came about, the process of it, and yes, and we just covered the topic on how this particular act can curb smoking issues, especially vaping among the youngsters. That was something we just discussed. Getting back to two of our questions here before we end our show here, Doctor. Doctor, what are the preparations that MOH did to enforce this particular standalone act, which is Act 852? How did the whole preparations come about?
So I've mentioned since this act is passed to the Dewan Negara on 14th of December last year.
Okay.
So after that, we have engagement sessions with the industries, with the local authorities, with the NGOs, professional bodies to explain about this act and to get the input and also feedback. So from what they expect from this act. We also have a briefing with the State Health Department to explain about this act and how to implement this on the ground. And to date, the MOH also has appointed about 6,500 authorized officer to enforce this act. And we also have discussed with the other ministries and local authorities on the power delegation to help the MOH to enforce this act as well. So we hope that this act can be, it is not the Ministry of Health alone, but it should be the one government approach where other governments and other agencies also help us to bring or to enforce this act also.
Right. So it's a process. It has to go through a process and a lot of parties are involved.
Yes.
Doctor, one final question, and just before we round up Momentum Health on Track. So what's your final say about the act?
Okay. I hope that all Malaysian and those who are living in Malaysia, professional bodies, NGO, industry will support this act. As I mentioned, this act is mainly to help to curb smoking issues, especially among the youngster. And apart from that, if any question about the implementation of this act, you can always contact us, the Ministry of Health, at 03-8892-4552 on Monday to Friday from 8 a.m. to 5 p.m. Or if you notice any people out there, if you notice anyone smoking at the non-smoking area or places, you can always complain to our WhatsApp or at 010-860-8949. And for smokers and bathers, this act is not to punish you. We want to help you actually. In fact, you can always log on to our website jomquit.moh.gov.my to get help to quit smoking through a proper or better way. Alright?
Okay.
So we hope that this is the smoking issue and also vaping can be reduced in Malaysia.
Nicely said. Thank you so much, Doctor. And it was really enlightening to get all those information and details from the process and how it starts to the process of the people involved to get this act in action or in force. And yes, help. That's the most important point. How can somebody ask or reach out for help when they would like to be, probably quitting smoking? So thank you so much. It's a tirelessly effort done by the Ministry of Health Malaysia and many parties that are involved to get this enforced. Senior Principal Assistant Director, Disease Control Division, Ministry of Health Malaysia. Thank you so much, Dr. Muhamad, Hairul, Nizam, Abdul Hamid, who is our guest today, talking about the Control of Smoking Product for Public Health Act 2024, the Standalone Act, Act 852. Thank you so much, Doctor.
Thank you, Gilbert. Thank you, listeners.
Thank you. And to our listeners right here, thank you so much to our producers, Achu and also Azura in the studios. And if you happen to be logged on to us right here on TRAXXfm social media platforms, that's where you can watch the interview of the day, which is on Momentum Health on Traxx. On YouTube, it is TRAXXfm Official. On TikTok and also on Facebook, it is TRAXXfm. Thank you so much for joining us on the show. Back in a bit. Stay tuned.